Et nous allons débuter avec...
And we will begin with you, Ms. Cohen.
The CPA, or the Canadian Psychological Association, is the National Association for the Science, Practice and Education of Psychology in Canada. We're very pleased that the Senate Committee is looking at children and youth mental health. In 2006, it was this same committee that published Out of the Shadows at Last, Transforming Mental Health, Mental Illness and Addiction Services in Canada. This report was truly a watershed moment for advancing the mental health of Canadians. We've come a long way since the report was released. The Mental Health Commission was created, and Canada's first national mental health strategy was released. Mental health is top of mind, and stigma and discrimination are decreasing. Budget 2017 included $5 billion over 10 years for mental health. Although CPA is highly supportive of this commitment, we believe that long-term and sustainable and predictable funding tied to improving access to evidence-based services is required to realize parity between physical and mental illnesses in Canada. Page 5 of Out of the Shadows report makes an important point, and I quote, "Statistics prove that medication alone is not as successful as a combination of both psychotherapy and medication. Other forms of therapy are not available to those of us on fixed income or incomes that do not allow for the sometimes high cost of therapy through psychologists, social workers, and alternative therapists." Unfortunately, despite our mental health accomplishments over the past 12 years, this statement is still true today. According to the Mental Health Commission of Canada, an estimated 1.2 million children and youth in our country are affected by mental illness, yet less than 20% will receive appropriate treatment. By age 25, approximately 20% of Canadians will have developed a mental illness. At any given time, approximately 12.6% of children between the ages of 4 and 17 experience clinically significant mental health problems, which can lead to serious consequences such as poor school performance, substance use, and self-harm. Children with significant problems can be identified as early as age 4 to 7. The strongest evidence for return on investment in mental health involves services and supports for children and youth. Services that reduce conduct disorders and depression, deliver parenting skills, provide anti-bullying and anti-stigma education, promote health in schools, and provide screening in primary healthcare settings for depression and alcohol misuse. Reaching children where they live, learn, and play is critical. This means reaching them in schools, where psychologists play an important role in the prevention, early intervention, and treatment of mental health problems. Psychologists in schools bring specialized experience developing and evaluating prevention and intervention programs, as well as in assessing and diagnosing psychological and cognitive disorders. When treatment is needed, school psychologists can apply evidence-based interventions. To ensure that school psychologists can deliver these services, an appropriate ratio of psychologists to students must be maintained. Generally, the ratio should not exceed 1 school psychologist for every 1,000 students. When scope of practice includes comprehensive prevention and treatment services such as assessments, teacher and parent consultations, crisis response, and psychological treatments, this ratio should not exceed 1 school psychologist for every 500 to 700 students. When psychologists are assigned to work primarily with student populations who have significant special needs, such as those living with severe emotional, behavioral, or developmental disorders, the school psychologist to student ratio should be even lower. Integrating mental health services into primary care is also an important step because this is where parents and families often bring their health concerns first. Staffing primary care settings with psychologists and other mental health providers can ensure a stepped care approach that is timely and responsive. Earliest development impacts the whole lifespan, including mental health later in life. The substantial neurological, physical, cognitive, and behavioral development that occurs in the first few years of life is heavily influenced by experience. Parents and caregivers can shape these experiences, providing an optimal target for earliest interventions to support lifetime mental health. Support for families and infants can include informational campaigns that are as simple and inexpensive as signs and locations families typically frequent, such as supermarkets or bus stops, identifying specific, easy ways parents can encourage optimal development. Home visits, already employed in Canada, have found to be effective at reducing emergency healthcare use, as well as negative cognitive, mental health, and behavioral outcomes. And mental health supports for parents, particularly parents experiencing challenges. Despite efforts geared at health promotion and illness prevention, some people will develop psychological problems and disorders for which they will need treatment. Access to effective intervention for mental health problems should be available to all Canadians and not depend on income level or access to privately secured health insurance. If mental health staffing ratios in Canada's public institutions are not realistic or not maintained, children and families who cannot afford to pay for treatment in the private sector end up on long wait lists, depend on medications alone, or do not get help at all. If we want a healthcare system that delivers cost and clinically effective care, then we must revision the policies, programs, and funding structures through which healthcare is provided. CPA urges all levels of government to invest in evidence-based mental health solutions. Canada has fallen behind other countries like the United Kingdom, Australia, the Netherlands, and Finland, who have established mental health initiatives that include covering the services of psychologists through public health systems. These initiatives are proving both cost and clinically effective. These initiatives provide care people need by the regulated health providers trained to deliver it. Thank you.